Morning. Welcome to the 10th annual LGBT Health Workforce Conference. We've made it. We've made it. Yes. It's been 10 years. 10 years. Can you believe it? This is a huge accomplishment. Let's give ourselves a round of applause. Who are our first timers here? All right. Any second timers? Great. Third? Who's been with us at least 5 years? 10 years? Me. So we started in 2012 at Hunter College in an effort to gather leaders in clinical care, research, education, and leadership on behalf of the health of the LGBTQ community and the LGBTQ health workforce. And unique to our conference is our focus on the health workforce, how we best support our workforce, both LGBTQ professionals and our allies, both to stay motivated and inspired to continue to advocate for our LGBTQ communities. In addition to our regular programming, this year we created the LGBTQ Academic Leadership Seminar to prepare you to advance in academia, sessions specific to becoming a full professor, becoming a department chair, becoming a journal editor-in-chief, and becoming the president of a hospital. Senior leaders from across the country will share their personal and professional stories about how they translated their LGBTQ health advocacy into advancement. So I implore you, take every opportunity to engage with them, network with our senior leaders. Today can be the first day of a new professional journey for each of you. Myself, our co-chair, Dr. Jeff Wood, the board of Building the Next Generation of Academic Physicians, the conference executive committee, programming committee, and training committee members. Anyone that's on our committee, can you please stand for a moment? Okay, it's Dr. Brewster, Dr. Cathcart, Dr. Herron, Dr. Cooper. These are our key leaders who helped develop an excellent program for each of us. Dr. Wood, wave your hand so everyone sees you. We want to thank our sponsors, including Weill Cornell Medicine, Northwell Health, New York Presbyterian Hospital, Deloitte, Planned Parenthood, Mount Sinai Health System, and the Albert Einstein College of Medicine. They've all worked very hard to make this event a rewarding educational experience for everyone involved. This is the first year we've organized a hybrid event in response to the health risk posed by the COVID-19 pandemic. Although some of us are physically distant, we come together this week as a community to recognize and celebrate our health advocacy work. Where are you joining from today? Anyone want to say where they're joining from? Brooklyn, all right. New York, Southern California. Oh, welcome. Texas, Sacramento, wonderful. Florida's representing. You know, I think we have some Vegas, right, Cheryl? Las Vegas. New Mexico, excellent. Kentucky. Where else? Any New Yorkers? All right, there are some New Yorkers here. Great. And who are you? Where are the medical students? Raise your hand. Excellent. Any physician assistants? Nursing. Excellent. Social work. Excellent. Public health. Excellent. Hospital administration. Wonderful. Thank you. Anyone I'm missing? Any health professions I'm missing? Patients? Psychologists? Dentistry. Thank you. Nurse anesthesia. Anyone else we're missing?
Frank.
Hey, Paul, what's up?
So I think it went pretty good last night.
Oh,
I finally
sorry. AV Techs, we can hear you.
I want to take it, and I have to spend some time on Frank's.
Jeff, can you tell them? They're all the way to the left and back. Okay. So this year's conference theme, Envisioning the Future LGBTQ Health Workforce, asks us to work together to develop the next generation of LGBTQ health professionals. New educators, new researchers, clinicians, new leaders are needed to further health equity for our LGBTQ community members and to foster increased professional paths for LGBTQ health professionals. What would you like to see in our future? Does anyone come here today with any ideas of what we like to see for our future? How do you envision it?
More people here.
Sorry?
More people here.
More people here, okay. More people engaged. What else? What else would you like to see happen?
More SOGI data collection.
More SOGI data collection, thank you. More sexual orientation and gender identity data collection at our academic health centers, our hospitals, our clinics.
More money.
More money for everything, more money for salaries, more money for research, more money for education, more money for our senior leaders.
Not having our healthcare politicized.
Thank you. Not having healthcare politicized. Not having our healthcare politicized. Excellent.
More queer professors.
More queer professors, more out professors,
More allies.
more allies. No more policing queer bodies. Safety and healthcare. Okay, those sound great. I'd like to take a moment now to recognize our conference's 10th annual Leadership Award winners. They worked tirelessly on behalf of all of us, and we thank them. Our Organizational Leadership Award goes to the George Washington University LGBT Health Policy and Practice Program and the Mount Sinai Health Systems. Our Health Professional Leadership Award goes to Dr. Chase Anderson from the University of California, San Francisco. Our Junior Leadership Awards go to two individuals, Naomi Green from Johns Hopkins Bloomberg School of Public Health and Sam Dubin from NYU School of Medicine. And our 10th anniversary Health Professional Leadership Award goes to Alex Gonzalez from Harvard Medical School. So another congratulations and thank you to them for their tireless work on behalf of the LGBTQ community. We do still have some tickets for the awards dinner tomorrow evening at Griffiths Faculty Club. So please join if you can. If you're interested, please approach the registration desk with your interest, and we'll get you passes for the dinner. Also during the conference, we will highlight our award winners in video presentations during the virtual session break. So please stay tuned for those. Also a special thank you to our 3-year service award recipients, Dr. Patrick Herron. Patrick, can you stand? And Dr. Brett Cooper. Thank you. Dr. Herron and Dr. Cooper have been very involved with the programming and executive committee functions for the conference. They've been with us for at least 3 years. So thank you again for all of your support. I want to give a special thanks to Dr. Jeffrey Wood, Dr. Anthony Foe, and Andrea Montgomery. Where's Andrea? You pull her in? Oh, stand up, Andrea. Andrea is our BNGAP fellow and future physician scientist. So thank you again for ensuring that all of our events run smoothly. Now for some housekeeping issues. So you should be able to see, I just wanted to run through the program really quickly. So everyone should have received a copy of our program. When we ended up finishing the program, it was nearly 80 pages. So we printed the schedule at a glance because 80-page booklet was just a little too cumbersome. But I did want to highlight a few things. One, anyone that is applying for CME credit or New York State psychology credits, please refer to page 7 and use the QR code to register for CME credits. You'll also receive an email next week, just as a reminder to submit your CME form for appropriate credit. Today and tomorrow on page 8, if you're a medical student, resident, or fellow, we're going to be organizing some focus groups to discuss pre-faculty competencies for diverse medical students and residents. So the dates and times for those sessions are listed as well as an associated QR code. In terms of today, you can see on page 9 a review of our events for Thursday. Those are on page 9 and 10. Events for Friday on pages 11 and 12, and events for Saturday on pages 13 and 14. Northwell Health will be hosting a career recruitment table all day on Saturday, April 23rd. So if you're interested in looking at health professional careers within the area at Northwell Health, please approach the table to discuss opportunities there. Pages 16 and so on have a detailed outline of the schedule, including session times, locations. If you're participating virtually, just hover over the Zoom, wherever you see Zoom, just hover over and click, and you'll be launched to the room for the virtual session. You'll also find a detailed listing of the session titles, the presenters, the moderators, and the learning objectives. Okay, let's scroll past this. And then starting on page 40, you'll see a list of our in-person poster presentations. The in-person poster presentations will be taking place on Saturday from 1:30 to 2:30 on the second floor of this building. And then the virtual poster presentations will be taking place on Saturday as well. And the same idea, if you're participating virtually, just hover over the Zoom icon and it will take you to the appropriate room. Starting on page 46, you can see the biographies for our committee members. And then starting on page 60, on the PDF that was sent to everyone, you can see the biographies for individual presenters. Okay, page 72 highlights the sponsors for our conference, followed by some advertisements from our advertising partners. Okay, any questions about the schedule of events? Okay, so yeah, please take a moment to review the program so you know which sessions you wish to participate in today. All the in-person rooms are located on this floor and on the second floor, and you can get to the second floor either by elevator or the stairwell behind the food tables. Okay, and also don't forget to follow us on social media, right? And you can see all of our social media links at the bottom of each page, both Twitter, Instagram, Facebook, and LinkedIn. Okay. So I want to, again, thank everyone for attending today. I want to welcome the Dean of Weill Cornell Medicine, Dean Augustine Choi, to give some opening remarks. So please give a round of applause for Dean Choi.
Okay, thank you. Welcome everyone to New York City and Weill Cornell Medicine for many of you. And it's great to finally get back in person meeting, although the last couple of years you guys had a very nice virtual meeting. So on behalf of Weill Cornell Medicine, welcome. And we are really very committed to this event. You know, Weill Cornell has had a long-standing history of dedication, commitment to equity. Just to give you a historical background, you know, we had a pretty young medical school founded only in 1898, about 125 years or so. And in the first admitting class, there were 46 women admitted when there were only 3 schools at that time that even accepted applications from women. So, you know, our history goes back many decades. And of course, Cornell University founder Ezra Cornell, many of you know this, but good things needs to be repeated. It was found on the basis of any person, any study. So, you know, and this conference, Reflecting in Community, is no different. It's part of the entire equation for us to achieve equity. You know, equity, in my mind, is the best way and the only way to achieve or fulfill humanity and justice in our society. So I commend all of you to be here to really over the next several days, talk about issues important in what we do. Saw the program before I got here, and it's terrific. Education, research, clinical practice, healthcare policy, HIV, career development, mentoring, diversity. It really is superimposable to every academic mission that all medical schools have. So I commend all of you. I want to thank Nelson Sanchez, of course, one of the leaders in the space. Let me see if I get this right. You're in terms of the 10th year anniversary of this health care force. And it's a nice ringing number. 10th year is always good for anything. So congratulations on milestone and for many, many years to come. We've made gains and have better legal protection in this community, whether it's federal, some states, some local. We have work to do, but in this very tough line of social justice, it takes patience, dedication to move the needle. And the important thing is moving the needle. And I think it is happening in all facets of our attempts to achieve equity at all levels. So your commitment is inspiring, and Weill Cornell will continue to do what we can do to have an impact in this field. So I do want to quote some numbers that Nelson gave me for this conference. It's amazing. The last 10 years, 25,000 registrants nationally, some internationally. So that's 23 leaders have been recognized, and we heard some of that this morning. Over 500 abstracts, over 250 oral presentations, and 400 posters in these meetings, and at least three peer-reviewed articles in this space for the conference. So again, congratulations. This is important because the only way to disseminate what you do here is through not only social media and all that, which is the current era, but through writing down on paper. And you guys are doing that. So I won't take more of your time. I, again, welcome all of you to Weill Cornell Medicine in New York City. And events like this are very impactful. It just doesn't affect the registrants here, but also institutions and our local, regional, and federal leaders. So have a great conference for the next few days, and hope to see you back next year by the same time. But we'll see how the pandemic holds. I think this coronavirus has proven that we can't be assured of anything, but hopefully by next year we'll be fully back in force. So thank you again, and thank you, Dr. Sanchez. Thank you.
Okay, welcome back. So we're going to get started on our first session for the day. Reflections on 10 years of LGBTQ SGM inclusion in academic medicine. I'd like to introduce Dr. JP Sanchez. Dr. Sanchez has worked extensively to promote diversity and inclusion in the medical and academic medicine workforces. He's the founder and principal investigator of the Building the Next Generation of Academic Physician Initiative and co-founder president of BingGap Inc. Dr. Sanchez is also on the editorial board of the Journal of Academic Medicine and is associate editor for MedEd Portal, overseeing the diversity, inclusion, health equity collection, the two peer-reviewed and PubMed index journals of the AAMC. He is executive director of the Latino Medical Student Association, the largest Latino medical student association in the country, with over 140 chapters at both allopathic and osteopathic medical schools across the country. He has published 52 peer-reviewed publications and 6 book chapters, and served as editor for a book by Springer Publishing entitled Succeeding in Academic Medicine, a roadmap for diverse medical students and residents. He is of Puerto Rican ancestry, gay identified, and raised in the Bronx. Please welcome Dr. JP Sanchez.
So good morning, everyone. Buenos dias. It's great to be here 10 years later. I remember when we started this conference 10 years ago. Does anyone remember where we were at? It wasn't here at Weill Cornell. Does anyone? Hunter College, which is just about a couple of blocks up. And what what really made Hunter an important institution to start off with, one of the biggest reasons is that Hunter has a huge pre-med program. Uniquely, Hunter's pre-med program has a large proportion of women, as well as underrepresented racial and ethnic identified college students. And they had a women and gender studies department. So I don't know if we have any students from that program, but when we think about the mission of BINGAP, which I'm going to go into, it just seemed like the perfect alignment. And now we're here at Weill Cornell, also as a second home for the conference. So it's great to see everyone as we celebrate the 10th anniversary. And, in reflecting on this day, and I'm happy that we're here together as well, given that COVID has kept us apart for the past 2 years, we thought it would be really nice to reflect just on not only the past 10 years, but maybe going a little bit further back. So I like touch upon a little bit of a history. As we recognize 10 years, it's good to celebrate our accomplishments as a community. I think we've all benefited from great role models, mentors, and champions to do the work that we do. And I remember one of the first LGBT mentors I had, Jeffrey Escoffier, which I'll show a picture of him in a moment, really gave me a greater appreciation of the socio-political activism of our community, even before the HIV/AIDS epidemic, right? We've always existed, but our struggle has changed over the past 50 to 100 years. When you think about it, even during the HIV/AIDS crisis, but when we think about really this first era of socio-political activism for our community, it was a time when being out was to also carry an identity of being un-American or being a pervert, being frequently attacked by the establishment, including being imprisoned, having our clubs raided, like down in the Village, which precipitated the Stonewall riots. And things started to change after the Stonewall riots of 1969, where we said, we weren't going to tolerate it anymore. We were going to stand up, we were going to fight for ourselves and expect something different. Around the same time, around 1973, homosexuality as a term was removed from the Diagnostic and Statistics Manual, which is really the manual that many practitioners were using to classify individuals, their patients, when they came into their clinical settings. And think about that. If you went to your provider, whether it was a nurse practitioner, a dentist, a physician, depending on what you shared or your complaint, that word at that time, which carried many negative connotations, would be put in your chart and you would be labeled. We survived and we continue to thrive against HIV/AIDS, but our journey in the early 1980s led to significant death and mortality for many of our friends, loved ones, and community members. And it took several years, nearly 6 to 7 years, for our government to finally pay attention and call for a response led by Reagan in 1987, after the first case had been reported in 1981. But by that point, tens of thousands of community members had died, and died in conditions of isolation, without an appreciation of what it was like to suffer from various opportunistic infections. The rallying call emerged that silence would equate to death. And what we became acutely aware of is that our community had been silenced not only around HIV/AIDS, but around many other health disparities and health conditions. And as we started to collect data in our communities, led by a variety of community-based organizations like Fenway and Callan Ward and Brown, in our academic institutions, we came to appreciate the different incidence and prevalence of substance abuse, alcohol, cigarette smoking, cancer, breast cancer, ovarian cancer, invisibility, how we were being recorded in our medical records, and our continuing struggle of being miscategorized, isolation, and how that translated into higher rates of anxiety and depression. And all these things culminated during a period where we were struck by HIV/AIDS. I think many of you, I'm going to take a couple of moments just to reflect on my own journey during this period as someone who's approaching, still got a couple of years off of 50, but I'm getting there, right? So reflecting back over the past 40 years in my own journey, and I'm going to ask you to also think about those people who have influenced you, and I'm going to ask you to share that. But one of the most amazing experiences I had during college was doing a pipeline program at Morehouse School of Medicine in Atlanta. So I got to go to Atlanta in my late teens and come out, and I met the first medical epidemiologist, Ken Dominguez, who was working on pediatric HIV. And he was literally like a godsend. And that's why I put that little yellow halo around his image. And it was the first time that I met someone who was out, gay identified, a Latino, who was doing work in our community in a dual way, looking at pediatric HIV amongst Latino communities and LGBT communities. And then Jeffrey Escoffier, who some of you may know, has been a speaker here at prior conferences and was one of the directors for the Office of LGBT Health at the New York City Department of Health and Mental Hygiene. And looked that up. I think it was a really important period for the New York City Department of Health to actually have an Office of LGBT Health. Unfortunately, I just heard yesterday that he fell and had a stroke, and he wasn't able to join us. And that's why the time that we spend together is so valuable, because you don't know when things are going to change. So we should all send our warm wishes to him and his family during this difficult time. And then also Peter Selwyn at Albert Einstein College of Medicine, who is leading palliative care for a variety of communities, including the LGBT community. And that was really during my college years. But then as I think about early days of medical school and graduate school in public health, meeting Dr. Peter Meacher, who we worked together to develop the first Bronx LGBT health center. It was the last borough of the 5 boroughs to have an LGBT center, and being able to do campaigns in Spanish and English, talking to lesbian and bisexual women about how smoking in front of their kids might make asthma exacerbations worse for their kids, and creating bus campaigns around that in the Bronx. And then having those campaigns taken down because to note a family led by a beautiful lesbian couple was considered inappropriate in the 90s. Insane. And then, also experiencing as a first-year medical student at Albert Einstein College of Medicine, the reality that if you were a gay couple or a lesbian couple or transgender couple, you would not be giving student housing, like your peers at Albert Einstein College of Medicine. And it took medical students to sue the institution to change that. And they won. The medical students won. Right. And it's all those little steps that make a difference for all of us. And I share that because that was my experience and probably a similar experience for many of you. But now we've entered into this new third era that I consider one of excellence, that's been pivoted by a number of reports that have come out by the Institutes of Medicine, U.S. Department of Health and Human Resources, where the disparities that I mentioned that were occurring around the HIV/AIDS epidemic, now there's greater attention and a call for us to better understand it, collect the data, SOGI data, include it properly in medical records, and so forth. New rights are being called for around marriage. As you know, in 2015, finally achieving marriage equity and the inclusion of sexual orientation and gender identity in the Civil Rights Act. And now we have journals, the Journal of Transgender Health and LGBT Health. Just going to skip over some of this stuff. I just want to share a video, before we go into hearing some of your perspectives. And this video was done when we did the first conference 10 years ago. If you're not aware, this is Dr. Elizabeth Ward Rollins, who's the daughter of Audre Lorde. So let's see if we can.
I'm called Honesdale. It was about 40 miles outside of Scranton. And I'd been there for about 2 years when a trans woman came in. My patient's story was that she'd been to 3 endocrinologists in the Scranton area and been refused. All 3 had declined to see her and to help her manage her hormonal treatment. This patient found me because 45 minutes away, she'd heard there was some LGBT clinician in the area. And we're talking across 3 counties.
So it's important to be trained in LGBT healthcare for numerous reasons. Historically, and we're aware now that LGBT individuals have received poorer care than their non-LGBT peers.
The patient really is at the center of everything we do here, and we want to provide the best care possible. And I think providing the best care possible means being culturally competent to do so.
Recently, within the last year, I had a pediatric patient who identified as a transgendered woman, and a lot of the people on my medical team had no idea what to do with the patient. They just kind of wanted to work through the symptoms of the patient, but not really look at the patient as a whole, and not necessarily because they had a problem with the patient being a transgendered woman, but because they didn't understand some of the issues surrounding being a transgendered patient. And so being able to discuss that with my patient and find out what my patient would like to be called and how my patient would like to be identified, and being able to have that one-on-one conversation with my patient was really important, because I felt like I had a relationship with the patient and I was able to relay really important medical information to the rest of my team.
For many, many years, LGBT people have relied on LGBT identified healthcare providers or settings, wonderful programs that kind of filled the gaps, but they were oversubscribed, they were underfunded, and they weren't available to everyone. You had to be in a major city, you had to be near a federally qualified health center. And now, with more and more people coming out and being out, LGBT accessible and competent care across this country, everywhere, is really, really important. And that means our mainstream institutions have to come up to speed. So that's really where we need to go. We need to make sure that our mainstream institutions don't just have policies and procedures and good intentions, but they know how to put those good intentions into practice.
I think it's important to come out for a number of reasons. And this is true for many populations that are underrepresented in medicine, including LGBT populations, women, racial ethnic minorities, is that as you come out and you progress through academic medicine and careers, you end up serving as a role model and a marker for the next generation.
Felt like the benefit was being able to answer any question completely honestly. I could just be authentic.
The education aspect of medicine and clinical practice is very, very important. It's something we try to focus on as well, that by being out, you're helping to educate, you're helping perhaps in ways that you probably don't know, to counter stereotypes or impressions that people have. And so that's why it's so vitally important.
Realize that you're not doing it just for yourself. You're doing it for your fiance at home, for your children in the future, for your friends who are living in places where it's really dangerous for them to come out. If you can come out, I think you should. And I do it because it's just the truth. It makes me feel comfortable. And also, it's a little bit of advocacy.
I feel like I've been very blessed and lucky, where growing up, my parents felt it was very important for myself and my brother, we're both gay and we're both physicians, to be confident. I've always felt very lucky to have that support network at home. And having that support network at home also not only gave me the courage, but also built in me the expectation that I should always be treated with respect and that I can be out in any setting.
Being a successful physician or scientist, it always involves an element of risk. And I think people should be who they are and accepted for who they are. We need to really foster a culture here where there is no risk for a student to come out and say, I am this or I am that.
I would say call to action to all LGBT clinicians who may not find themselves in San Francisco, New York City, Detroit, Miami, and other places where they may have a thriving culture and LGBT other clinicians to sort of network with immediately available. You won't even know your value until you come out as a clinician in those places.
So I was having a vain moment. I was like looking at the shirt and tie I was wearing and I was like, oh, why did I wear that? But anyway, that was the style 10 years ago. But to that point, we just want to take a moment and just open it up for some reflection from all of you to consider, what were your challenges over the past 10 years as we reflect on our journey together as a community, personally and professionally. And then we'll go into some successes. So anyone would like to share some of the challenges that you may have experienced in your community or at your academic health sciences centers?
And if you don't mind being recorded, or
Yes.
if you're like, no, don't record me, just let me know.
A lot of conversations happen at the conference. Many times.
I'm from the University of Puerto Rico School of Medicine. America Facundo is my name. I'm in the internal medicine department. And we have an issue with religiosity at the school. And so anything that departs from the dogma of the different churches that are represented among the faculty has been an issue. It's going to be 30 years that I've been at the school in June 30. It has been an issue. So when I started working on LGBTQI plus issues in the curriculum, I had these religious faculty sit in on my lectures and activities, seminars, forums, and expressing their opinions against. They evolved to expressing that was not so bad. And at this point, they don't dare anymore sit there and make any comments. But at the beginning, it sure was a challenge, and I had to specifically request support from the deans so that I could go ahead and do what I needed to do without the inappropriate intermission of religion into the issues of human rights, because this is an issue of human rights, as so many others, women reproductive rights, which they also are against all our rights. And I'm sure that all you know what religion means at the university when we're talking human rights. So I think that's a good thing to share for people to reflect on how that has affected their own context.
Thank you.
Okay, so my name is Alberto Alonso. I work as a social worker at at Weill Cornell CSS. And this is the first time I see something so open personal in terms of personal and professional. I'm a gay man, and I remember I'm a social worker. I'm not a doctor or psychologist or anything like that. But I was out there. in discos, and I remember. But then some of those people that I used to see there, they used to come to the clinic, and some of them I used to see them, and it was a very challenging for me because sometimes they recognize me, sometimes I even kissed them. I didn't know. And make me think. I thank God for my supervisors. I have great supervisors. In terms of start separating my personal life, my professional life. But at one point, I saw my social life diminished because I was afraid of clients and patients having the wrong idea with me, and I'm still struggling with that, but it's something that we face and people don't talk about this, that we have a social life, especially those who identify themselves as gay, lesbian, transgender, or questioning. So that's it. That is a hot potato that I give to the audience.
Thank you. Thank you for sharing that perspective. It's very important. Yeah, we do all have our personal lives, and when they intersect with our professional lives, how we navigate that is very important.
Hi, everyone. I'm Maria Cano. I'm from the University of New Mexico. And this is a personal topic for me as well. I guess I started working with the LGBTQ community about 17 years ago and have been out for 35 years. And I was still finishing my doctorate at the time and working at the university. And at the time, I wanted to write a project working with the LGBTQ community with another professor, and was told to stop navel gazing, that this was too personal and that I shouldn't be working with my own community because that wasn't good science. And then I was told that LGBTQ people were good at advocating for themselves and it wasn't important. And the reason I bring that up now, because I guess that was in 2013, is that this is so important because right here in this room, there are 4 people from the University of New Mexico. So, and I'm still doing work at UNM and am now an assistant professor there. So I just want to say change can happen, but you have to really be persistent and really stubborn and just don't take those kinds of things personally.
Hi, everyone. My name is Samir Mohammed. I'm a medical student at New York Medical College. And something that I've experienced both in my personal and I guess professional life within healthcare settings is constantly feeling like I have to come out to both new social groups that I join, coming to a new school, feeling like I have a pressure to come out or I'm scared to come out because I don't know how people might respond. And the same situation is when I'm seeing providers feeling like there's barriers to me coming out and having to explain that, no, I don't have male partners and having to answer closed questions or expectant questions. And so I would like to be the kind of provider who doesn't have those barriers for my patients and who can ask questions that are just open and allow my patients to answer them freely and without feeling like they have to oppose the expected question that I've asked.
Hi, everyone. My name is Danny. I use they, them pronouns, and I work in electrophysiology for Northville Health. I actually work out in Long Island in South Shore University Hospital, and I am trans non-binary. And although I'm not a provider, I work in scheduling for the hospital. It's an interesting experience to have to reiterate my pronouns every day to people. Like Mira, like I feel like I'm constantly coming out to people like, oh no, I don't use she, her pronouns. I use they, them pronouns. So there's a lot of education that goes along with who you are as a person, which can be mentally taxing and exhausting all the time. But we have to remember that we are fighting for visibility every day. And so if we can take part and we feel comfortable taking part in things like that, it's a really good idea to present yourself in that way where you can give visibility to others and make others comfortable in the same environment as well. So again, progress is coming, change is coming. It's just a little bit harder, but it's getting there. Hi, my name is Rachel Tommen. I'm a second year medical student at New York Medical College as well. Something I've encountered professionally is though there are LGBTQ educational aspects to our program, sometimes the faculty teaching them don't believe the slides they're presenting. So recently I was in a lecture where the faculty member questioned the validity of a study of depression rates, suicide rates, and different kinds of drug abuses within the LGBT community, going like, oh, I really wonder how they got these numbers. I'm not sure if this is real. In the classroom where I'm sitting as a lesbian woman. So I responsively watched the whole lecture, spoke to him afterward, and then reported him to the faculty. So he won't be teaching it again. So it's just really important that we also are mindful about our faculty education and making sure we continually educate our teachers as well, so that we can all be better providers.
Thank you. Excellent work. Oh, want to do one? Raise your hand. Just introduce yourself, please.
Hey everyone, my name is Jay. I use they, them pronouns. I'm a medical student at UCSF and also a lifelong patient there. And I'd say some of the challenges that I've experienced were first as a patient, not seeing providers ask the right questions of me or document my correct pronouns and lived name within my medical records, and just generally not feeling safe when I seek care. And now I'm a medical student kind of on the other side of things. And I think a really big challenge for me has been feeling really unheard in a place that really prioritizes, quote, progressive values, and feeling like a lot of work has been done to improve the messaging such that there are signs on campus that say your pronouns matter, but then in the classroom, my pronouns don't matter all of a sudden. Or when I'm working with patients, the pronouns aren't asked or are misrecorded. And so I think some of the challenges have been around getting people to understand the difference between at face value, showing support, and actually learning the skills to take care of our community. And I'd say another challenge that has gone with that is that I felt really overburdened as a trans student myself to do the work of changing my institution to be more trans inclusive. Not me alone, another med student here with me. And I'd say the two of us are putting in way more work than we should be as medical students. And so the challenge is, I think, trying to get the institution to buy in that it's their job to make these improvements. And it's my job to learn and be a student, but the students can't do everything to improve these schools and these institutions and the actual care delivery. We have a role, but it shouldn't be our job.
So those are the conversations I want us to continue having
Let me just check the chat box.
over the next 3 days. This is that brave, safe space for us to share and also learn from each other, and to celebrate, right? As much as it is a burden, it has been the journey of our community, and to pause and take a deep breath and to thank each other, right? Thank you. Thank you for continuing the work. I think, as you heard from many, we're not only practitioners, right? We have techs, we have researchers, we have our students, we have our faculty, we have our social workers. That's what this space has been about, right? All together, you are a team, right? We don't take care of any individual that walks in to our academic health center individually, right? Everyone is a part of providing that inclusive space and creating that inclusive space. I just want to highlight some of the things that many of you echoed that we deal with on a day-to-day basis, and assume that responsibility for ourselves and our community members, concepts of coming out, being out, for some continued internalized homophobia, double homophobia when you face it not only within American culture, but other communities that we're a part of, whether it's Latino identity or African-American identity or tied to another culture. It's not all about sex. We are more than what we do in the bedroom or in other settings. The laws and protections that we continue to advocate for on the federal, state, or even within our institutions, right? The policies that we're constantly writing and then turning into practice. Generational bias, what it means to share our perspective, which many times is beautiful, but also we carry a huge burden at times to constantly bring it into different research, education, or clinical settings. What it means to drive excellence, like our SGM cancer care team that's showing us a great example, and continuing not only to build that knowledge base, but bring it into our classroom settings and our patient care settings to provide it to our community members. All of these things that we take on a day-to-day basis. So I just want to take a moment and recognize and remind you all of some of the things that were shared. But along the way, look at what we accomplished as a community over the past 10 years. 2 significant Supreme Court rulings that came on the backs of individuals that have been leading this fight for over 50 years. Whether you decide to get married or not, that's your decision. But at least now we have that option across 50 states. And now we are finally recognized by the Civil Rights Act of 1964. 1964. That right did not change. That law did not change until 2020. And now, irrespective of sexual orientation or gender identity, we have education rights and we have employment rights. We have come to appreciate through efforts of different organizations, such as the Association of American Medical Colleges, that we are a marginalized group. And there's evidence, there's data that says that our students, and this came out in 2014, have higher rates of stress, lower social support, and higher financial concerns. And it is true, what is the responsibility of our graduate schools, our institutions, knowing this? This is the data that is published. Knowing these findings, what do we do now to change the culture and climate in our institutions so that our students have an equitable chance of reaching their optimal potential and shooting for the stars? Organizations like the AAMC have put out statements, but a statement is just a statement without action, that all institutions ensure a safe learning environment for all students, regardless of their sexual orientation or gender identity. And the LCME, Liaison Committee on Medical Education, forbids discrimination based on sexual orientation or gender identity in medical education programs, and how this may now serve as an example, but also an opportunity for other organizations around nursing, dentistry, psychology to also co-lead. We know that our trainees, and I am focusing more on medical, but I think this has application to other health professions, that as our students go on to residency and fellowship program, depending on their interest, they may face more discrimination or isolation. Like this study reports that there is less SGM inclusion in areas like orthopedics, neurosurgery, thoracic surgery, and other surgical subspecialties. And it's not only about supporting us during medical school, right? It's about ensuring that as we move ahead in residency and as we serve as faculty, that culture and supportive climate should be extended. Our faculty, who we expect to lead in many settings, themselves struggle to be out and supported, right? So really no one is safe, right? And we have to create a safer environment for everyone, as indicated in this publication by Mensch, who is a medical student when this article was written, whereby faculty often feel like their scholarship does not yield promotion potential. They're not afforded similar opportunities in leadership. They can't be out in front of colleagues. They can't include SOGI variables within their research topics. But there are articles that list better practices for institutions to apply to transform our culture and climate. And there's numerous documents on new goals and benchmarks that we want to achieve that have been listed, as you can see here, through the Institutes of Medicine, U.S. Department of Health and Human Services. Over the past 10 years, we also saw the immersion of the Office of Sexual and Gender Minority Health at NIH, right? And why did that matter? We've had an office for women. We've had an office for health disparities. And finally, now there's an office for sexual and gender minority health to do many of the same things that the other offices have done. Provide a focused lens on our unique health issues and health disparities, but also set up pipeline and pathway programs for trainees as well as faculty, junior and senior faculty. Medid Portal has emerged as an important peer-reviewed PubMed index journal where you can publish your LGBT content and curricula. So often we say, well, no one's teaching in our schools what's going on in our communities. Well, part of it was, one, there wasn't a journal where you could really publish teaching materials. Now Medid Portal represents that. But more importantly, the leadership of Medid Portal really acknowledges and values LGBT submissions. I recall, Nelson and I submitted an article in early 2000 to a couple of journals, and the editor would send us rejections and say like, oh, my audience of readers, this wouldn't be of interest, learning about LGBT health. Like editors of journals would literally send you rejections and say like, this wouldn't be, like people don't want to know about LGBT. And so know that now journals are creating that space for us, which helps us document our work and validate our efforts. And since the inception of the LGBT Health Workforce Conference, many of you have helped to contribute to new publications to further elevate what we're doing on the institutional level, which you see some of them here, and give us a better idea of what are the drivers for us to continue on serving as faculty and senior leaders, the pros, more teaching opportunities, research opportunities specific to LGBT health, community service opportunities, leadership, mentorship, and the cons. The constant lack of visibility drives us away from serving as future faculty. The lack of support to conduct LGBT scholarship, overt, explicit discrimination that we deal with on a day-to-day basis drives us away from becoming future faculty and leaders. I just want to highlight some of the other accomplishments in supporting our community through BINGAP and the LGBT conference. As you can see here, BINGAP, which is the parent organization for the LGBT Health Workforce Conference, amongst our members, nearly 1/3 of our members are a part of the LGBT community, as you could see in the final column. As well as when you look at our conference over the past 10 years, we've had over 2,200 individuals participate, with the vast majority, 2/3 being a part of the community. We are making explicit concerted efforts to support LGBT identified individuals and serving as our co-authors of our publications, right? We're not a center, but I think in many ways we act like a research center, right? And if you want to get promoted and assume leadership roles within our academic health centers, you must publish. It's not a tax. It's about driving diversity capital. It is our responsibility to publish what we do on a day-to-day basis, whether in the community, in the classroom, in our research labs. And as you can see here, 1/4 of all of our co-authors on BINGAP publications are part of the LGBT community, as well as for our new writing fellowship program, 16% of our fellows are. I want to acknowledge that Dr. Kano, Dr. Chang, Dr. Tammy Mari, and Dr. Sanchez have received this huge NIH grant to build the next generation of SGM cancer researchers. And I'm just going to ask you to stand up again, because this is, I think, if we give them a round of applause. So this is another example of how you can create a space that supports not only, people in getting into graduate school, but also in developing future researchers to do the work that we need them to do for our community. This is a space where we recognize your work, and we're recognizing Dr. Gonzalez as our 10th anniversary leadership award winner. Naomi Green and Sam Dubin are junior leaders. GW, and Mount Sinai for their organizational leadership on LGBT health, and our health professional leader, Chase Anderson, right? And we do this every year. Okay. I was told by Dr. Brewster we did this over, but we can still celebrate people over and over again. And so we're going to continue to do this, but this is what you should be doing at your own institutions and organizations, right? Creating that space to honor your community members. So with that, just sharing a few of our accomplishments collectively, what's the next 10 years going to look like? What do we aspire, not hope, but what do we aspire to achieve personally and professionally? So if we can hear some of your, based on what you've seen, where we've gone as a community externally, but also here within the National LGBT Health Workforce Conference community, where should we go over the next 10 years?
Yeah, I know I asked that as well at the opening. Does anyone want to add or share new thoughts, new perspectives? Great.
Hi, I'm Jasmine. Something I'm hoping for is like more and more across different like subfields of health, that LGBT competency is going to be like a requirement and not just an opt-in model. I feel like we're kind of having a mix right now. And, you know, as we all know, like there are going to be LGBT people that show up in every type of specialist and provider's office. So that's what I'm hoping for.
Shine Chang, MD, Anderson Cancer Center. I'd like to see more guidance and structure and leadership and toolkits built for helping the institutions transform themselves. I feel like, you know, as an advocate, I'm trying to push from the inside, but the institution, while they're willing, there's just not a lot of structure and modeling out there for me to follow yet. So I would like more structure, more framework, more people to help work on that.
Hi, my name is Sandeep Boprai. I'm from Northwell Health. My perspective is a little bit different. Being a South Asian queer person, I feel that hopefully in the next 10 years across intersectionalities, there's more people that come out, especially in healthcare. I run a transgender program at Northwell Health, and we have a lot of South Asian queer folk and from different intersectionalities that come through, and they live very stealth lives, and they have great professions. A lot of them are providers, and they don't feel comfortable to come out because of our culture. So I'm hoping within the next 10 years that changes across the board.
Anyone else?
Hi, my name is Michael. I'm a fourth-year medical student at New York Medical College. Recently matched into general surgery. So as Dr. As Dr. Sanchez mentioned, one of the questions that I ask myself is, should I be out during the application process? And hopefully 10 years from now, all of our programs, training programs throughout all specialties are inclusive enough where no medical student has to ask that question.
So I want to thank everyone for that. And it's really going to take your leadership to change that, right? To become the future program directors for residency and fellowship, to become deans of education, to modify the competencies, or other leaders to transform institutions. I'll just share a couple of things from BINGAP's side of how we hope to further support the LGBT community in terms of the work that we've been doing, not only for the LGBT community, but really also to encourage more women to serve in that leadership role in our health sciences centers and racial and ethnic minoritized individuals. So new concept that I want you to discuss with your leadership is titled pre-faculty development. So just like many of you were pre-nursing and now you're nurses, pre-dental and now you're dentists, pre-social work, and now you're social workers. Pre-faculty is you will become future. Oh, thank you. Good. One person is hearing me, right? But everyone go back and talk about what it means to become pre-faculty for your trainees to eventually serve in these leadership roles. And it's defined as providing trainees with foundational self-efficacy, knowledge, skills, and experiences to be successfully appointed and eventually promoted and tenured within an academic institution. BingGap has developed and published 2 books, one for college students and one for medical students, college students of all health professions, and then one specifically for medical students, residents, and fellows. And both books have co-authors that are part of our community. And both books highlight the experiences and perspectives of our community members. And also highlights those of women and racial and ethnic minorities, because the commonality between those 3 is that they are all marginalized within our academic health centers. So we wanted to focus on that. And there'll be 2 more books coming out in the upcoming year or 2, one on engagement and leadership, how you can eventually become deans of various offices, and then critical transitions, as mentioned, what you need to do when finding your academic residency, fellowship, or first position, academic position. We now have a National Center for Pre-Faculty Development, which consists of 25 organizations and institutions to work on an institutional level. How do we not only develop competencies, but integrate them to change the climate, culture, and landscape? And to Jasmine's, and I feel like we connected somehow because you mentioned competencies and now I'm talking about competencies. We invite you. We recently received a grant from the Josiah Macy Jr. Foundation, which sponsors a lot of medical education, to create pre-faculty competencies and milestones. And so we'll be doing focus groups at the conference, and we want our trainees and practitioners to join the focus groups. You can see here, just use your QR code, and then we let you know the room. But basically, how do we support LGBT identified, SGM identified community members to stay on track to serve as our future faculty and senior leaders? And we're going to use these focus groups to evolve competencies and then use those 25 institutions that are working with us to pilot those competencies and hopefully eventually reach a point where they become integrated and become practice, so it doesn't fall on the shoulders of 1 or 2 students, right? But everyone assumes that responsibility. But most importantly, I just want to thank all of you, right? Many of you have been a part of our journey over the past 10 years. And many of you, I hope, will continue on that journey with us. And along the way, we will grow. More students will join us and allow us to retire at some point. But I just want to thank you for helping make this conference a huge success and for serving our community. So thank you. Looking forward to meeting all of you this weekend.